Republicans will only know about 2 weeks after the local government elections whether voting will be a COVID-19 super spreader event. The National Institute for Communicable Diseases says 47 more people have succumbed to COVID-19 related complications in the past 24-hour period, while this puts the death toll to 89,151. Now, let's discuss this. We joined via Zoom by Professor Adrian Puren, Acting Executive Director at the National Institute for Communicable Diseases. Professor Puren, thank you so much for your time this afternoon.
Thank you very much, and good afternoon to your viewers.
Perhaps before we start about, the super spreader event that possibly could be this upcoming elections, we understand that 70% of the population of people that are 50 plus should have been vaccinated at least with one jab or one shot of the vaccine come December. So my question then to you is, will this be enough in order to prevent the fourth wave that we're hearing about? And also, is it achievable to have 70% of the population that are 50 years plus, vaccinated by December?
Well, I hope that it is achievable. I think it's really critical, because I think by vaccinating those particular groups that are vulnerable, and especially those that have comorbidities, will really be important for us to really make sure that we can mitigate against a resurgence that's seen in this particular incident, for example. So I think it's really critical that we move all the efforts to try and vaccinate those critical groups as soon as possible.
Prof, unfortunately, your line is not coming out too clearly, but let's continue here and see how far we get with this interview. But in terms of the, utterances that were made by the health minister saying that the department will only essentially know 2 weeks after the elections if indeed the voting was a super spreader event, what can we make out of those utterances?
Well, I think critically as well, the election can be divided into different parts, if you like. There's the electioneering events where people had gathered in large numbers. That's one area where you could possibly have super spreader events. And then I think the next phase would be the actual election day in and of itself. But I think it just depends on how those particular events have actually been managed in terms of ensuring that the numbers do not exceed what was prescribed, and that within that context, for example, that there was sufficient physical distancing, wearing masks and so forth. So that was not well controlled. And those events would, in and of themselves, contribute seeing possibly spikes and so forth. Again, tracking back to those events may not always be that straightforward. So even then, we would certainly see within post the electioneering period any spikes or community outbreaks that may contribute to the increase in numbers. But we're not really seeing any marked changes at this particular point. And again, if we start seeing increases in cases, it's not necessarily that we can always attribute it to the events around the election.
Prof, we're seeing the numbers coming down quite considerably, but we're still hearing from various experts that, the fourth wave is a possible likelihood that it would happen, and it will happen by December. Talk to us about what these latest numbers mean, and what do we read about the projections of a fourth wave?
Well, I think it's impressive that we have got those numbers down. Of course, we'd like to see them decline even further. But as we go into the December-January period, of course, the likelihood of greater contact may well contribute to an increase in the numbers. And of course, if people are not adherent to the non-pharmaceutical interventions, that also is a contributing factor. But coming back to your earlier point, I think that we've had a fairly substantial or significant third resurgence. So there may well be an extent of natural immunity. Plus, I think if we are able to really increase our vaccination numbers, I think that will really change the complexion of the so-called fourth resurgence. So we may well see smaller resurgence happening, and also heterogeneity across the different provinces as well. So we are hoping that the hospital services, in terms of hospital capacity, oxygen supply, staff and so forth, should not be markedly overwhelmed.
Prof, what are we to make about these vaccine booster trials that we know will be commenced very soon? We know that SAPRA has approved that Sisonke COVID-19 vaccine booster, which will then go into trial sometime this week or next week. Talk to us about, are we in a position as South Africa, given the number of people who have vaccinated and are fully vaccinated, to be talking about booster injections and, for vaccines?
I think similar to how we started off our vaccine campaign, I think we need to start focusing, for example, on vulnerable groups. So, for example, the healthcare workers, I think, will be an important group to consider, given the duration since they've been vaccinated and the evidence from various other studies outside of South Africa to show that there is so-called waning immunity in those individuals. So, again, to prevent severe disease, hospitalizations, and so forth. I think it will really be critical to have those types of discussions and implementation as well, and then consider how we can expand that approach in terms of adding so-called boosters. I know that there's debate about availability of vaccines and the utility of boosters, but I think we shouldn't say it's a one or the other. I think we should see how we could manage both approaches. In other words, getting maximal coverage as well as trying to introduce boosters.
All right, Professor Puren, thank you so much for availing yourself for this interview this afternoon. Thank you. Really do appreciate it.